Good morning, everyone. As India continues to fight against COVID, so we bring to you PANACEA, a very, very special campaign supported by Viatris and a concept by eHealth Magazine and Elex Technomedia Private Limited. We bring to you PANACEA. It is a session which is a dedicated campaign for the next 6 months, which will be going live every Sunday in the morning at 7:30 a.m. with various sessions like yoga, nutrition, and also psychiatrists. We also have doctors from Narayana Health specialty, where we'll be having sessions about cardiology, endocrinology, neurology, and also a lot of sessions about pulmonology. So today we have a very special guest with us who will be conducting live yoga session. We have with us Ms. Shohini Roy Chaudhary Dasgupta. She is a professor. Hi, welcome Shohini ma'am. She's a professor of Natya Shastra and yogi and a dancer. So we'll have a great session with her and we'll get to learn a lot about mudras, which is very apt and all guests who are attending the sessions can also sit at their comfort of their homes, and along with them you can also conduct the session. So, Shohini ma'am, I leave the screen to you, and please, you can continue with your session.
Namaste and thank you, Pooja, for the introduction. Good morning, all of you. I'm Shohini Roy Chaudhary from Shohini Moksha World Dance and Communication, based out of India, Spain, and Germany. Today, I will bring to you wellness at your fingertips, which is done with the mudras that we hold for dance, but it is very valid and very effective in creating vibrations in the body, which helps to heal a lot of diseases, including cholesterol, thyroid, diabetes, and obesity. I would also bring to you certain breathing exercises, and what we are going to do today is something that you can practice while sitting in your asanas on your floor mat, on your yoga mat, or you can do it, when you're waiting between projects, waiting between conferences, on your sofa, waiting at airports, waiting at doctors' chambers, on a normal chair, or anywhere, any place, because breathing exercises and mudras can be done from the comfort of a sofa, a work desk, or your home, or in front of the television, how you want to do it. And it can be done every day and repeatedly to have healing effects on your body. As you know, Swami Shivananda had said that yoga is not about standing on your head at all. It is about calming the mind, to reduce stress and anxiety, to bring about the healing properties to your body. And so we are going to concentrate on calming of the mind today. And yoga, according to our Bhagavad Gita, our sacred text, is a journey of the mind, through the mind, and for the mind. So we are talking about mental wellness here, which affects your physical wellness too, and takes you to a calmer state where you're not affected by hypertension, anxiety, stress, and other factors that are the main culprits in causing disease in the body. First and foremost, we'll talk about our position, how you want to sit. You could sit in your Padmasana if you want. Padmasana has various effects on the body. For example, it is very good for your spine. It opens up your hips. It eases your knee joints. It helps you breathe better, and it's very good for your posture. It keeps your spine completely straight. If you have discomfort sitting in the Padmasana due to sciatica or any, stretch related pains, You could just sit in your Sukhasana. Sukhasana is the asana for complete comfort, where you just cross your legs and sit on the floor if possible. Sukhasana is one of the easiest postures, and it builds you up for more advanced yoga postures with practice. And Sukhasana is the complete comfort of your body, which also helps you from contacting urinary diseases. It helps your spine. It gives you more confidence and mobility, and it also gives you a sense of well-being and calm. The third option that you have is to sit in the thunderbolt position. You can sit in your Vajrasana on your knees if that is comfortable for you, and do your breathing exercises. Vajrasana is very good for the uterus. It is known to have a healing effect on your digestive systems, and one recommends that after meals every day, if you could sit 15 minutes in your Vajrasana, it helps facilitate your metabolism, it facilitates digestion, and it produces the digestive enzymes which you need to digest your food, less acidity, less reflux if you have a problem with with your digestive tract. And would be recommended also to breathing exercises. However, today I shall demonstrate the breathing exercises in your normal Sukhasana. Just cross your legs and sit. The three breathing exercises that I show you are, as I said, you can do it anywhere, sitting on your sofa too, because it is the upper part of your body. It involves the upper part of your body. We shall hold the hand first in the Jnana Mudra, which is the thumb and the index finger joint lightly touched, and the other three fingers together and stretched lightly, turned upside down to face the ceiling, and stretch it on your knees. Now we are going to inhale in with long exhale. Inhale, let's say 1, 2, 3, 4, and exhale out for 6 to 8. 1, 2, 3, 4, 5, 6. And inhale 1, 2, 3, 4. Exhale 1, 2, 3, 4, 5, 6, 7, 8. We'll do 9 more cycles. We've done 1. Start with me. Inhale, all of you. 1, 2, 3, 4. Exhale 1, 2, 3, 4, 5, 6. And inhale. Exhale. Count in your mind. 4, 5, 6. Inhale. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6. Longer. 7, 8. Yes, excellent. Again. 1, 2, 3, 4. And exhale. 1, 2, 3, 4, 5, 6, 7, 8. 5 more cycles. And inhale. Exhale. Inhale, exhale, inhale, exhale to the count of 8. Last 3. Inhale, exhale, inhale, 1, 2, 3, 4, exhale, 1, 2, 3, 4, 5, 6, 7, 8. We have done the first exercise, and I would like to tell you that this is to detox the body, because oxygen is the most important chemical in your body that helps purify and detox. And when you breathe right, each time you inhale, the oxygen purifies you, detoxifies you, and you exhale, the carbon dioxide brings out all the impurities. So this is a natural detox. I have done it with you today 10 times, but ideally 20 times to 30 times would be perfect for you. And as you can see, I don't know if you can hear clearly, I have music playing in the background, because right from the Vedic age, raga, healing with ragas is also a very important aspect of yoga and Ayurveda. And healing with ragas has helped improve metabolism, calm our minds, remove hypertension, help balance high blood pressure and low blood pressure. It has helped cholesterol and actually helped cardiovascular health. Today we are going to work out, do our yoga, asanas, our breathing, and our mudras with the Raga Desh and Raga Kirwani. Raga Desh helps to balance the left and right side of the brain, brings about a sense of calm, soothes your nerves, has cardiovascular effects, it helps heal and heals thyroid, heals anxiety symptoms. Kirwani builds up confidence, keeps your spine straight, keeps your bone health in order, and also helps calm your mind and keep your brain very alert. So these are some of the effects of raga healing, and we are going to use these two ragas as we are looking at a complete healing and wellness within the comforts of your home or office or wherever you may be waiting or delayed, where we have raga healing us and our breathing exercises and mudras sending the right energy flows through the channels of our body to heal existing ailments and also to create and build resistance during the COVID. If you've already suffered from COVID, this is to bring about a sense of wellness and make sure that you heal right. And if you haven't suffered, I hope, and this is built around building your resistance, so you may have a stronger immune system and combat with COVID better. So we go on to the next exercise, which is the Kapalbhati, which is again restricted breathing to bring about wellness and detoxify your body. Take both palms, put it over your navel. You can put the right first or your left, as you please. Now the method here, we breathe in full inhalation, a deep breath when you can't breathe anymore, and then restricted release of breath. Each time you exhale, you pull in your stomach. Make sure that your breath is completely exhaled by 5 or 6 exhalations. While you do that, you inhale first completely. While you exhale in bursts of 5 or 6, you pull in your stomach and you feel that constriction, you feel that breath leaving your body as you pull in your stomach, and this is conscious breathing. And you're breathing through your diaphragm. We do 10 rounds of this. Start with me. Inhale long and exhale. 1, 2, 3, 4, 5. Long inhale and long inhale and exhale. 1, 2, 3, 4, 5. Long inhale, exhale. Long inhale till you can't go more. Hold it for a second and exhale. 1, 2, 3, 4, 5. For all these counts, 1, 2, pull in your stomach. 3, 4, 5. So this is conscious breathing. Pull in your stomach. Pull in. Breathe long and exhale. Pull in. 2, 3, 4, 5. 6 more counts. Breathe in. Fill your nostrils with air. Breathe out. 1, 2, 3, 4, 5. Long inhale. Fill your lungs with air, with oxygen in the morning. The best time to do your yoga. Close your eyes. 1 second, stop, and then 1, 2, 3, pull in, pull in. Inhale deeply. 1 second, pause. Exhale. Pull in your stomach. 2, 3, 4, 5. Inhale deeply. Feel the oxygen entering your body. Exhale. Pull in, pull in. 3, 4, 5. 5 more counts. Inhale deeply. 1 second, pause and exhale. 1, 2, 3, 4, 5. Inhale and exhale. 1, 2, 3, 4, 5. Inhale deeply and exhale. 1, 2, 3, 4, 5. 3 more counts. Inhale deeply. Feel the oxygen. Exhale. 1, 2, 3, 4, 5. Inhale. Fill your lungs with air. Exhale. 1, 2, 3, 4, 5. Inhale deeply. 1, 2, 3, 4, 5. Last 2. Inhale and exhale. 1, 2, 3, 4, 5. Last breath. Fill your lungs with air. 1, 2, 3, 4, 5. Okay. You can stretch your arms. Kapalbhati is over. If you've done it right, you'll feel lightheaded with that oxygen. The body feels lighter, lungs feel stronger, and you're more energized, sense of calmness. As the raga healing continues, I would like to tell you the musicians playing the sitar and the violin are Pandit Subrata Roy Chaudhary on the sitar and a very renowned musician, Vidushi Madhuri Chattopadhyay, playing the violin. She's currently in Berlin. So enjoy the music as we continue our breathing. Next, we will go on to the alternate breathing mode. Nadi Shuddhi, as it's called. Nadi Shuddhi in Sanskrit, Nadi is the channels of energy, that is in our body, guided by the left and right nostril. And Shuddhi is the purification, Shuddhi is the detox. This is alternate breathing. As we breathe in through the left nostril and exhale through the right nostril, and again inhale through the right nostril and exhale through the left nostril. This is alternate breathing and helps our lung health, helps remove congestion, it helps our wellness and anxiety, it helps to relieve us from stress. However, this must not be done when you have a mucus or a congestion in the nose, if you're suffering from flu or a cold or fever. Similarly, the Kapalbhati, what we did, with the restricted breathing, where you feel your breath is not to be done. If somebody is pregnant, during pregnancy it is not to be done, or if the person suffers from high blood pressure or low blood pressure, then it is not to be done till the senses are calmed down. This we are going to do. Take your right thumb of your right hand, press it upon your right nostril, and this is the mudra we hold, the ring finger and the little finger out, the index and the middle finger folded in, and the thumb out. We hold this is called the Vishnu mudra. With the Vishnu mudra, hold your right thumb to your right nostril and hold it tight. Breathe in through the left nostril. Now block the left nostril with the other two fingers and release the right nostril and breathe out. Breathe in through the right nostril. Release the left nostril and exhale. Breathe in through the left nostril. Release the right nostril. Breathe out. Breathe in through the right nostril. Release the left nostril and exhale. This can be done up to 100 times a day. For now, we are going to do 10 times, so you know exactly what to do, because this is a routine that can be followed by you every day in the morning. If you can't make time in the morning, it could be done in the afternoon or in the evening, as and when you're free. So we continue with this. Here is your Vishnu mudra. Block your right nostril. Breathe in through your left. Release the right nostril. Exhale. And breathe in. And release the left nostril. Exhale. And inhale through the left nostril. Breathe out. Exhale through the right nostril. Breathe in. Breathe out. Breathe in through the right nostril and breathe out through the left. Breathe in. Inhale deeply through the left nostrils. Release the right. Exhale. Inhale through the right nostril. Release the left. Exhale. As we inhale through the left nostril, the body goes into the relaxation mode, rest and relaxation mode, and there are vibrations in the parasympathetic part of the nervous system. And as we breathe in through the right nostril, the body goes into the flight or the fight mode and directly influences the sympathetic part of our nervous system. So this, as the body balances and alternates between the flight and fight mode and the rest and relaxation mode, the left and right side of the brain, the hypothalamus, calms down and finds a balance to balance the body, to balance the energy, for a sense of calm, for a sense of peace, and causes wellness within us. It is also very good for the lung power and for the cardiovascular health. So with this, these are the 3 breathing exercises that you can all do every day. I'll just sum up quickly so you remember. The first is the inhale and long exhale. Inhale and long exhale, which detoxifies and purifies your body, taking in oxygen, giving out carbon dioxide. We inhale for a count of 4. 1, 2, 3, 4, and exhale for a count of 6 to 8. 1, 2, 3, 4, 5, 6, 7, 8. Once more. Inhale and exhale. The second that we did is the Kapalbhati, where you press your palm over your navel, just above, and you inhale deeply, hold for a second or two, and exhale as you pull in your stomach. 2, 3, 4, 5. Inhale deeply, exhale, pulling in your stomach. 2, 3, 4, 5. Not to be done if the person is pregnant, not to be done if a person has high blood pressure. The third breathing exercise that we did is the alternate breathing or the Shuddhi, the Nadi Shuddhi, with the Vishnu Mudra, right thumb over the right nostril, breathe in through the left nostril, deeply, restrict the left nostril, release the right, exhale, inhale through the right nostril, inhale through the right nostril, release the left, breathe out. So these are the 3 breathing exercises that we would all like to do together for your sense of wellness, for your COVID healing, for a general healing, general feeling of well-being, calmness, balance, and energy. Now we shall go to the mudras, which is an important aspect. According to the Maharishi Patanjali, the mudras, what happens is the mudras is the Sanskrit word for closer. Closer as your fingers, as you close your finger connects to various parts of your palm, and there's an energy circuit flow, which happens because it stimulates the brains to release the energy, to release the flow of energy in various circuits, which can alternately help us heal our body. The first mudra, which you all know about but may not have been practicing consciously, is the Namaste. When you do Namaste, elbows up, the palm folded together in your heart space in the middle of your chest. Namaste. Here, this is the mudra Anjali, mudra called Anjali. And as we press it lightly, each finger coordinated, stretched out, pressing to each other, it balances the left and right part of our brains in our body, helps energy flow, helps calm the senses, helps energize us, and it is also a matter of honor and respect to the person and to yourself. So here, all of you, here are your palms, elbows lifted up, not close to your body, not drooping, and away from your body. Here you are, holding your Namaste or Anjali Mudra. Hold it for a count of 5 seconds. 1, 2, 3, 4, and relax. Once again, elbows up, away from the body. This is in the middle of your chest. Fingers lightly pressed and stretched out. 1, 2, 3, 4, and 5. And release. It is good to do this about 15 minutes a day. You could do it while watching your TV program or while you're working at your office desk, on your office chair, and you have a moment to spare during your coffee break. And this mudra balances the left and right side of the brain, brings more balance to our body, calmness and stress itself. It provides relief from stress and anxiety, and has also been said that this balances high blood pressure, low blood pressure symptoms in the body, and balances our pressure. It also cures migraines and headaches, may be effective if it can be held for a good 20 to 25 minutes. It has been found to cure headaches and body pains. So after the mudra of Anjali, we will go on to the next mudra, which is the Jnana mudra, which is the most commonly used mudra in yoga. And here for Jnana mudra, the index finger and the thumb are pressed together lightly. The other three fingers are joined together, kept together and stretched. Here we are to hold it straight. When we are in yoga posture, it faces the ceiling or faces the sky, and here we hold it. You can hold it like this for a count of 5. 1, 2, 3, 4, and 5. Once again, 1, 2, 3, 4, and 5. Here is your Jnana mudra, the mudra for knowledge, the mudra for consciousness, to calm the senses, to make the mind more alert, to improve memory, and helps relieve aches and pains. And as you know, most yoga mudras, most postures bring a sense of well-being, improve lung power, and causes relief from stress and anxiety, calms our body. So here you have the Jnana mudra, which is used almost in all yoga postures. The Jnana mudra, I hope you can see me well. As you know, the 5 fingers in our hand, in our palm, represents 5 forces of nature, which influences our body. The thumb represents fire. The index finger represents air. The middle finger represents the sky, Akash. The ring finger represents the earth, and the little finger represents water. So these 5 forces of nature happen to be in our body and need to be balanced properly. So when we are getting into the Mudra Sutras, these 5 elements in the body are aligned in the correct balance for mental well-being, physical well-being, balancing weight, balancing thyroid, balancing the right and left side of the brain, and relieving anxiety and stress. The next mudra that we do, we've done the Jnana mudra, we've done the Anjali mudra. Next we are going to do the Prithvi mudra, the earth. The Prithvi mudra is done by bringing the ring finger to touch the thumb lightly. This is how we do it. In dance, it's called the Mayura mudra. But here in yoga, we call it it the Prithvi Mudra, as the ring finger represents earth, and pressing it to the thumb, the earth and fire in the body are balanced. And this Prithvi Mudra helps better spine control, more energy, more alertness, relieves lower back pain, and also sets aside our reproductive system, sets it to heal, keeps it intact. This is the Prithvi Mudra. Holding it for 15 to 20 minutes a day, if you can't do it at a stretch, even doing it 3 times a day, really brings about healing effect on the body. Here we go, Prithvi Mudra. So first we have the Namaste, the Anjali, the Jnana Mudra. Now we have the Prithvi Mudra, where the ring finger is pressed to the thumb. Once the body is earthed, we go on to the Surya Mudra, where you hold the Prithvi Mudra, the ring finger and the thumb are pressed lightly and brought down so that the ring finger touches the base of your thumb and the thumb presses upon the knuckle. The fingers are joined together, the rest of the fingers, and kept straight. And this is the Surya Mudra, the Mudra of fire, which balances the fire in the body. The Vata, Pitta and the Kapha, as you know, in the body, that is completely balanced by the Surya Mudra. Here is how you hold it. The Surya Mudra, here, the ring finger is brought down to touch the base of your thumb, and the thumb wraps around the second knuckle. This mudra, I would like to tell you all, is the superstar of all mudras. It helps your lungs, it helps your cardiovascular health, it balances your thyroid, it helps bring weight down and manage your weight. It brings high blood pressure and low blood pressure to a balance. It also helps pains and aches in the body and your joint health. This is what the Surya Mudra does to you, and it is definitely the superstar of all mudras. And the Prithvi Mudra, my friends, here that you go, the earth, as you know, is connected to the bones, the dust, and the muscles, and is perfect to combat arthritis problems. It keeps your bone density correct, it strengthens your bones, your spine, helps fight against arthritis, and keeps your bones very strong, keeps you agile and flexible. So we've just completed the Anjali, the Jnana Mudra, the Prithvi Mudra, and the Surya Mudra. Try and remember it one after the other. Next, what we are talking about, the 5 elements of nature, we will go to water. Water, here is the Varun Mudra. The Varun Mudra is how you hold the Trishula. You know, think of Shiva's trident. The little finger and the thumb press against each other lightly, and the other 3 fingers are kept straight, absolutely straight, stretched a little, like Trishula. Also done about 20 minutes a day. Helps the water balance in the body. As you know, our body is made up of 3/4 water. This helps in blood circulation of the body. This helps in the water balance of the body. This helps in detox and purification of the body, and has many healing powers. And the water balance of the body also keeps your sense of calm, well-being, and has a meditative effect on the body. So here you have the Varun mudra, the water mudra, the Trishula, the trident, to balance the water liquid in your body. It also controls the urinary system, the reproductive system, and helps your lung power and cardiovascular system. The last one here, the fifth mudra that we go on to, is the Vayu mudra, the air. We talk about Vayu mudra, is the air, as I told you. Your index fingers represent the air elements of your body. So here we will hold the Jnana mudra as I taught you. The thumb and the index fingers rightly pressed. Then fold the index fingers so that the tip of it touches the base of your thumb, and press the thumb over the knuckle. This is your Vayu mudra. The Vayu mudra, again, if it is held 15 to 20 minutes a day, can help relieve your body of extra gases. It helps digestion, it helps metabolism, and it helps your lung power greatly. So these are the Mudra Sutras which Maharishi Patanjali had recommended greatly for overall well-being. We'll go through it quickly to summarize so you remember. This is the Anjali, palm pressed together tightly. The Jnana Mudra, the index fingers and the thumb pressed lightly and turned out upwards. You have the Prithvi Mudra, the ring finger and the thumb lightly pressed. The Surya Mudra, where the ring finger comes near the base of the thumb and the thumb presses onto the knuckle. The Varun Mudra is the trident, Trishula, where the little finger and the thumb are pressed together lightly and the other three fingers are stretched straight. And you have the Vayu Mudra, the air, which looks like Jnana Mudra but has a subtle difference. Fold in the index finger so the tip touches the base of your thumb and wrap your thumb around the knuckle. This is your Vayu Mudra. We could also use the Prana Mudra, where the index finger and the middle finger are kept free and the ring finger and the little finger are brought to touch the thumb lightly. The Prana Mudra is the life mudra which balances your entire body, your water balance, your right and left side of the brain, and your cardiovascular health. This is the Prana Mudra. Most of the mudras, the fun about the mudras is most of the mudras can be done sitting on a sofa or a aeroplane seat or at the airport or in your yoga posture, or you could be doing it lying in bed while you fall asleep, excepting the Surya Mudra. The Surya Mudra being a strong mudra and energizing the body, symbolizing fire. The Surya Mudra is not to be done on an empty stomach and not to be done lying down. It has to be done sitting up straight in your yoga posture. All other mudras can take you to your posture of relaxation, and you can do it even lying down. So these are the mudras, my friends, today. And as I told you, balances, find the wellness within your fingertips, which is one of the basics that Maharishi Patanjali brought about. The fingertips, where you press, how you press, brings about your sense of healing, your sense of wellness. builds up resistance, and helps handle stress much better in these COVID ridden times. As you know, yoga and meditation is absolutely essential for bringing about peace and harmony within and without. And in schools and colleges that I work in Europe, it was seen that in Austria, they had introduced mudras and yoga among children between 8 and 13. And that group of children did not have any adolescent problems. So, music, I would recommend raga therapy along with mudra therapy and yoga to build up your health, to a better cardiovascular system, to better resistance, peace within, and a much healthier life of wellness, of resistance. And we pray that very soon we are free of the COVID menace. If you've already suffered, you should be in a better space to heal. And if you haven't, this helps build your resistance. Over to Pooja. If you have any more questions from the audience or from you, I would be very happy to answer and take this discussion of our breathing and Mudra Sutras further.
Hi, it was a very, very informative session. Ma'am, if you can slightly, inform more, because we are getting a lot of queries regarding the mudras, and if you can show us some more postures about keeping our internal organs healthy, and like other also other yoga postures, I mean to say.
I would also like to tell you the Bhairav Mudra, where the left hand goes here, right hand comes on top, and the hand is held away from the body. That is also very good for your bronchial systems, for your digestive system, and for your asthma. Bhairav Mudra is fairly easy, and this is how you hold it. There's a bronchial mudra where you press your index fingers to your thumb, and here you go. The index fingers held out here, the middle finger pressed to the thumb, and the other two fingers here. This is supposed to be the bronchial mudra. Pressed together for 15-20 minutes every day. It has healing effects on asthma, on your lung system. The asanas, some more asanas, if you would like me to do puja and all of you, I would like to show you the Vajrasan. The Vajrasan, which really helps digest, because I think during the COVID times when we can't go out or work out too much or leave our homes, we may have a problem with digestion. So you sit in Vajrasan. This is kneel sit. Your feet are parallel to each other together, and hands are straight and over your knees as you breathe in and breathe out. 15 minutes a day after any of the meals or after all meals ideally sets the digestive enzymes to work and helps overall well-being. And as you know, gut health is the most important part of your body. Gut health makes sure that your entire body is healthy. So this is the Vajrasan. Anything else, Pooja, that you would like to ask me on an overall health or?
Yes. So we are getting queries about like like we are having once a week session right now every Sunday mornings. So if you can enlighten us, if you can tell us about how to keep ourselves healthy throughout the week, like every day people are who are working and who has a lot of stressful jobs, also working from home. So if you can suggest a few postures of yoga which can be done very easily, who are very busy working right now. throughout the week, actually?
I would definitely, I do the Gomukasana a lot, where the right knee is over the left knee, aligned together as you can see. The feet are straight, facing the wall, and the right hand, lift up the right hand, bring it close to the ear and press it down, and from behind, use both palms to hold the left hand. And to the count of 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. As you breathe in, you change sides, change legs. Now you have your left knee over your right knee, and your feet are in a straight position, stretched out, and your left hand up, touching your ears, folding down, and your right hand from behind and clasping one palm into another. Look up straight, and as you breathe in and breathe out, count 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. This improves your posture and your aches and pains in the throat, sciatica issues, and keeps your spine in order. Helps oxygen flow into the system and helps blood flow also. So Gomukhasan and Vajrasan definitely, and Padmasan, of course, if your body allows you, with the mudra, Jnana Mudra, straight, breathe in and breathe out. To the count of 10. 5, 6, 7, 8, 9, 10. I would also recommend some basic stretches. Here we sit, pulling in this leg, resting the right palm here and stretching the right leg. Straight, as much as you can stretch it. Feel the joint stretching, holding on to the thumb. Bring it back, keep it on the mat, hands left, right next to the knee. Lift up your left leg with your left hand, clutching onto your toes, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And we sit in the butterfly posture. Here we go. And breathe in and breathe out. And back to the Sukhasana, comfort posture, legs crossed, but not Padmasana, which is universal. Anybody can do it. Anything else, Pooja? I would love to talk
Yes,
about before you.
yes, I am also getting queries on if you can explain about Kalathu Pranayam, which you actually explained it. If you can explain it again for the viewers, that will be a great help.
Absolutely.
Which they can, perform it every day at a daily basis.
Pranayam, as we first did 3 exercises in pranayam, are the breathing exercises, and it circulates the oxygen in our body And it is the first, basic, most effective, and easiest way of detox. Because oxygen being the most important component, the most important chemical in our body, it's inhaling the oxygen to purify the body, the organs, the tissues, and as we exhale, the carbon dioxide exhaled out detoxes the body, it brings the impurities out. So the pranayama, the first one that I showed, was the long exhale, which we inhale and exhale longer. So it helps detox the body and balance the system, balance the lungs, and brings a sense of well-being, lightheadedness, because it's all that oxygen going into the body. When we do conscious breathing and regulated breathing in the body, we are conscious of how we breathe, we are more mindful about it, then the oxygen carbon dioxide cycle balance works much better for the body. So that would be the first. The second one that I did was the Kapalbhati, which was the restricted breathing, where you breathe in and as you breathe out, you pull your stomach in, your palm flat and over your navel. So 2, 3, 4, 5. So you feel the exhalation by pulling in your stomach. So that is conscious breathing. Kapalbhati also could be, each of these breathing exercises could be done 50 times. The first one 50 times, Kapalbhati also 50 cycles, and the alternate breathing, the Nadi Shuddhi, which is done with the Vishnu Mudra as I taught you, that could be done 100 times. That you breathe in through your left nostril, release your right, breathe out, breathe in through the right nostril, release the left, breathe out, again breathe in through the left nostril, release the right, breathe out, deep breathing. So this clears the channels of energy, helps clear mucus, helps clear congestion, better health for your sinusitis, and overall metabolism and body wellness. So these are the three pranayams which you could do every day, 50 times each, and if you have a little more time, if you're a little bit more motivated, about 100 times each. Ideally in the morning, but if not in the evening at all, in the evening or when you have time, and this really makes a difference.
So, ma'am, that is, I think that has been a very, very useful session today. And, I'm sure a lot of people have been already benefited by it. And we would love to, attend a lot of sessions with you. And if you can say a few parting words and how to keep ourselves healthy through yoga, and because with or without medication, or with or without vaccine, which is yet to be which is yet to launch in India right now. So we have to take care of ourselves and take care of our immunity system. So if you can share a few notes while parting with us.
It has been wonderful to be here, Pooja, with you early in the morning doing one's yoga the way one is supposed to, and getting back into the core of our Vedic wisdom with healing with raga, healing with mudras, and healing with regulated breathing. This can help, this is universal, is applicable to all ages, all parts of society, and every part of the world. So, this is what India brings to the world with our yoga, with our asanas, with our pranayamas, and our mudras, and can definitely help heal the world pre COVID and post COVID times, and even times when there's no COVID, for overall wellness, for better energy flow, and less stress and anxiety. And yoga is aimed at the wider well being of a mass of people, total well being for everybody. So that is what yoga does, and I really hope that Panacea, collaborating with Beatrice, can bring about, it has already done so much of it, could bring about this change in overall health and wellness of everybody, of people at large, with minimum fuss, with minimum discomfort. This is what we pray for: yoga, meditation, peace, and wellness for all of us.
Thank you so much, ma'am. Thank you so much for being with us. And it has been a great honor, for attending your session. And we look forward to a lot more in few coming months. And please stay tuned with us. In few minutes to come, we have Dr. Ranjit J, MD, Senior Consultant, Internal Medicine with Narayana Health Specialty. So he'll be conducting a live session with us on pulmonology. And, please stay tuned with us for the same in this page itself. And for registration, it's for free. Kindly register at panacea.iletsonline.com. And I would like to thank Narayana Health and Viatris for supporting us for this very, very noble and a social cause. Thank you so much.
नमस्ते, मैं हर्षल देसाई आप सभी को आमंत्रित करता हूं एक काफी महत्वपूर्ण कार्यक्रम जो ई हेल्थ मैगजीन ने वियाट्रिस ऑर्गेनाइजेशन के सपोर्ट से कंसेप्चुअलाइज किया है और इस कार्यक्रम का नाम है पनासिया। पनासिया एक 6 महीने का एक ऐसा कार्यक्रम है जिसमें हम पूरे भारत देश से अलग अलग एक्सपर्ट्स जो कि योगा, न्यूट्रिशन, मेंटल हेल्थ, न्यूरोलॉजी, इसके अलावा एंडोक्राइनोलॉजी, इसके अलावा और दूसरे जितने मेडिकल फील्ड्स हैं वहां से अलग अलग एक्सपर्ट्स को लेकर हम 6 महीने के लिए हर रविवार को ऑनलाइन सेशन कंडक्ट करेंगे। ये कार्यक्रम इसलिए महत्वपूर्ण है क्योंकि हम सभी जानते हैं महामारी के समय में हम सभी लोग काफी एक डर के माहौल में रह रहे हैं। हम हमेशा ये प्रयत्न कर रहे हैं कि किस तरह से हमारे रोग प्रतिरोधक क्षमता हमारे शरीर की बढ़ाई जाए ताकि इस महामारी से हम बचे रहें। इन्हीं सब चीजों को ध्यान में रखते हुए हम लोगों ने इस कार्यक्रम की संकल्पना की है और इस कार्यक्रम में पार्टिसिपेट करने पर निश्चित रूप से सभी लोगों को बहुत फायदा पहुंचने वाला है। 3 चीजें हैं महत्वपूर्ण जो मैं आप सभी को बताना चाहता हूं। पहली चीज, ये कार्यक्रम ऑनलाइन हो रहा है जिसकी वजह से आपको अपने घरों से बाहर निकलने की जरूरत नहीं है। आप अपने घरों में बैठकर इस कार्यक्रम का लाभ उठा सकते हैं। दूसरी चीज, जो एक्सपर्ट्स, जो विशेषज्ञ हमारे इस कार्यक्रम में आने वाले हैं वो सभी काफी जाने माने और काफी फेमस प्रैक्टिशनर्स हैं, एक्सपर्ट्स हैं, रिनाउंड पर्सनालिटीज हैं जो योगा, न्यूट्रिशन, मेंटल हेल्थ, एंडोक्राइनोलॉजी, कार्डियोलॉजी, न्यूरोलॉजी, इन सभी चीजों के ऊपर लगभग 30 मिनट से लेकर 60 मिनट के इस सेशन में आपके साथ वार्तालाप करेंगे। और तीसरी चीज ये है कि इसके लिए आपको किसी भी धनराशि को देने की आवश्यकता नहीं है। ये कार्यक्रम एकदम फ्री है। आपके लिए ये कार्यक्रम एकदम फ्री है। सो मैं आप सभी को आमंत्रित करता हूँ, आप panacea.iletsonline.com इस वेबसाइट को विजिट करें। विजिट करने पर वहां पे आप रजिस्टर करें और रजिस्टर करके आप इन सारे सेशंस का जो कि 6 महीने तक चलने वाले हैं उनका लाभ उठाएं।
Welcome, Dr. Ranjit. You are on mute, sir.
Yeah, I'm just trying to share the screen.
Yes. So we are live at this moment, sir. Everybody is able to see us on the Facebook link and on the website where we are hosting this entire session live. And before you share your screen, I'd like to just brief all the audience and you also that we just had an amazing session on yoga by Sohini Roy Chaudhary, which started at 7:30 a.m. in the morning today. And the session by you is the second session today
Okay.
for our audience. We had about 1,500 people watching us live on our Facebook and YouTube channel. And I'd like to tell the audience that the next session is by Dr. J. Ranjit, who is a senior consultant internal medicine at Narayana Health on behalf of PANACEA and ELITS Technomedia Private Limited. I welcome you, Dr. J. Ranjit, in this session. And we thank you so much for taking time out from your busy schedule to address the gathering and accept our invitation to deliver a talk which can help people fight the disease, fight the pandemic, especially those who have recovered from COVID-19. So, if I am not wrong, Dr. J. Ranjit, we will like to present a PPT first and then deliver the talk. Is that so, sir?
No, I will do the PPT with the along with the talk.
All right, sir.
I'll share
Okay.
this. Yeah.
All right, sir. So I will request my colleague. I have introduced the audience about your session already, and we are going to have a large number of people listening to you, sir. Once again, I would like to tell our audience that this session is going to be for minimum 30 minutes to maximum 60 minutes. I request you all to please uh, stay tuned on our Facebook pages because these is indeed a great opportunity where people across the country are able to talk to or listen to Dr. J. Ranjit, who is a very renowned doctor from Narayana Health. So over to you, Dr. J. Ranjit, and I'll request my colleague Deepak to bring you on full screen and put me backstage. Deepak.
Yeah. Thank you, Harshal, for the introduction. And I thank all the viewers for spending time on this Sunday morning to listen to this talk. Are you able to see the screen?
Yes, sir. Yes, sir. We are able to see the screen.
Are you able to see the post-COVID sequelae?
Yes.
Yeah.
Yes. 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 Yes.
So, good morning, everyone. So, today I'll be speaking on the post-COVID sequelae. Um, just as you all know, COVID has changed the way we go about with our daily routine and changed the way how healthcare itself delivers its services. We'll go through with the following headings. We'll first introduce you all to what is a post-COVID sequelae and why it is important. How do we define that post-COVID sequelae, and what are the components we see in the post-COVID sequelae? How do we follow up? And what is a post-COVID-19 holistic assessment? We'll go through in this following order. So, since the outbreak of the COVID-19, most of our attention has been focused on how to contain the transmission of COVID-19 and addressing the treatment of critically ill patients in acute care settings. Gradually, now in the coming weeks and months, the emphasis of the healthcare facilities will gradually involve also the post acute care of post COVID 19 survivors. Why this is important? What is this post COVID sequelae? If you see the cases in India and again in Karnataka, we see among the cases more than 94% of them have recovered, and they are less than 5% active cases in India. So a bulk of these patients, of even if a small percentage of these people are going to develop post-COVID-19 complications, the implications are large for the healthcare community and also for the people. It is anticipated that COVID-19 will have a major impact on physical, cognitive, mental, and social health status in patients with mild disease presentation also. It needed be that only the severe COVID-19 will have a post-COVID sequelae. Patients who have been asymptomatic or who have had very mild disease also can develop any of the complications of post-COVID-19 sequelae. And previous outbreaks of coronaviruses too, such as MERS and SARS, have also been associated with permanent pulmonary function impairment, muscle weakness, pain, fatigue, depression, anxiety, occasional problems, and reduced quality of life to various degrees. So, what is this post COVID 19? Post COVID 19 or long COVID, as you all would have come across this term, long COVID, is nothing but a post acute COVID 19. It seems to be a multi system disease, sometimes occurring even after a relatively mild acute illness. So, how do we define what is post acute COVID 19 and chronic COVID 19? Let me tell you, there is no defined definition yet, as this is a new disease and things have been changing every day. So, according to a journal which was published in the BMJ, post acute COVID 19 was defined as symptoms extending beyond 3 weeks from the onset of first symptom, and chronic COVID 19 as symptoms extending beyond 12 weeks. And usually, a positive test for COVID 19 is not a prerequisite for diagnosis. Why? Because only a few persons have access to test. One, a lot of patients who have mild disease or who are asymptomatic get well without even realizing they would have had COVID. And when they come back later with the post COVID 19 sequelae, we test their antibodies, they are positive. It shows that they could have had infection in the recent past. So, what are these persistent symptoms in patients after COVID 19? Several studies have shown that post COVID, some percentage of patients have persistent symptoms even after discharge. The symptoms can range from fatigue, dyspnea, joint pains, cough, anosmia, rhinitis, red eyes, loss of taste, headache, persistent sputum production, lack of appetite, sore throat, vertigo, myalgia, and diarrhea. In a study which was done in Italy, it was found that in patients who had recovered from COVID 19, 87.4% reported persistence of at least one symptom, particularly fatigue and dyspnea. So, why are only some people affected and some not affected? It is really not known why some people's recovery is prolonged. Some of the reasons postulated are a persistent viremia due to weak or absent antibody response, relapse or reinfection, inflammatory or other immune reactions, and mental factors such as post-traumatic stress may all contribute. Like I said before, long-term respiratory, musculoskeletal, and neuropsychiatric sequelae have been described for other coronaviruses in the past too. This figure shows the clinical complications of COVID-19. We can see that as all the organ systems are affected, and needed always only be only the lungs which are affected. This just depicts the various organs which are affected. By far, but the most common indication for admission to a hospital is a viral pneumonia. And more than 80% of the hospitalized patients are generally cared for in the medical wards. Only a small proportion of them require additional ventilatory support and are admitted to HDUs and ICUs. Interstitial lung disease and pulmonary vascular disease are likely to be the most important post-COVID-19 respiratory complications. So, like I told you, the pulmonary sequelae, the sequelae after COVID infection, is mostly going to be the pulmonary sequelae, and also other organ systems are also going to be affected. So, what do we see in the lungs? Lungs, we see an impaired lung function, lung fibrosis as a sequelae of pneumonia, ARDS, and a condition called pulmonary thromboembolism. Some of the risk factors for pulmonary fibrosis following lung COVID-19 infection are age. Greater the age, more the risk. Illness severity. More severe the illness, more chances of a pulmonary fibrosis. Length of ICU stay and mechanical ventilation. Longer the duration of stay, the likelihood of pulmonary fibrosis is also more. And smoking and alcoholism. When there is no proven effective targeted therapy against pulmonary fibrosis, the risk reduction measures should be directed at limiting illness severity and protecting the lung from other incidental injuries. Usually, persons with pulmonary fibrosis have a reduced quality of life. They do not maintain their saturation levels, have breathing discomfort. They are sent home with an home oxygen. Home oxygen is usually advised when the saturation is less than 90%. And it can be delivered, oxygen can be delivered in home via oxygen concentrators and via oxygen cylinders. Another important role is the role of these antifibrotic agents. Currently, we have two agents which are available. One is pirfenidone and nintedanib. Their role in post-COVID-19 pneumonia, pulmonary fibrosis needs further research in the present pandemic. The current literature is suggestive that any potential anti-fibrotic intervention should be considered within the first week of ARDS onset so as to be more effective. Currently in India, AIMS says there is no evidence to support the use of these agents. I would like to mention that in our institute, in persons who are seen to be developing these lung fibrosis, we initiate them on one of these drugs at the time of discharge. Persons who are not maintaining saturations less than more than 90%, who have fibrotic changes on their CT, are initiated on any one of these agents, and we have seen good outcomes so far. We are yet to publish these studies. Also, another question which many of us keep asking us: should a COVID-19 patient receive post-discharge thromboprophylaxis? So patients hospitalized for any acute medical illness are at increased risk for venous thromboembolism for up to 90 days of discharge. Venous thromboembolism, nothing but, the blood clots in the blood vessels in the leg veins, and they can dislodge and go into the pulmonary circulation. So patients should be educated on the signs of venous thromboembolism at hospital discharge and advised to seek medical attention should these develop. It can be swelling of the calf, pain in the legs, breathing difficulty, chest pain, any blood in the sputum. All these are some of the symptoms which we must look for. There are various societal recommendations regarding anticoagulation on discharge in COVID-19. These are various international guidelines which I have put out here for your reference. Like CDC says it is not recommended. American Society of Hematology says to consider thromboprophylaxis. The ACCP guideline says again it can be considered. There are mixed reviews. AIMS also does not recommend anticoagulation at discharge in routine post-COVID patients unless indicated for other reasons. I'd like to mention again that we are routinely prescribing patients anticoagulations for 4 to 6 weeks after discharge, after their COVID-19. We have found a significant persons with COVID-19 come back with this condition called as pulmonary embolism. To prevent this, we put them on anticoagulation. Some of the cardiac sequelae also have been described. Patients can have an irregular heartbeat, or it's called arrhythmias, an ejection function decline, can have an acute heart attack, myocarditis. Neurological sequelae, they can have headaches, seizures. Myoclonus is nothing but twitching movements in a individual muscle or a group of muscles, persistence of absence of sense of smell, ataxia, posterior reversible encephalopathy syndrome, which is characterized by headache, seizures, and altered consciousness and visual defects. There's always an increased risk for an acute cerebrovascular event and Guillain-Barré syndrome. Gastrointestinal sequelae can have, the patients can have hepatocellular injury and persistent GI symptoms like vomiting, pain abdomen, loose stools. Musculoskeletal sequelae also are quite important, which is noticed in quite a lot of patients. They have severe muscle weakness, reduced joint mobility, difficulty in verticalization, ischemic necrosis, impaired balance and gait, critical illness polyneuropathy, and critical illness myopathy. Next is the cognitive sequelae. Patients can have difficult awakening with long-lasting confusional state and psychological problems, delirium, and other cognitive impairments. Other sequelae are described such as dysphagia, impaired swallow and communication, and decreased in activities of daily living. Another common thing which should have come across in various articles now is this multi-system inflammatory syndrome. Characterizes children. It most commonly occurs in children, but also is been reported in adults. This has been reported in Europe and America, and very few cases in India. So how do we define these people? Usually they are children and adolescents, 0 to 19 years of age, with fever for more than 3 days, with having any one or two organ involvements. They can have a rash or conjunctivitis. They can have the ulcerations on the mouth, mucosa, hands, and feet. They may present with hypotension or shock. They may have features of cardiac involvement. They may have myocardial dysfunction, pericarditis, valvitis, or other coronary abnormalities. And there's an evidence of coagulopathy, that's they will have bleeding manifestations, or they may present with diarrhea, vomiting, and abdominal pain. So children and having any of these two organ involvements, and they will have any elevated markers of inflammation such as ESR, C-reactive protein, and other inflammatory markers. And there is no other obvious cause for inflammation or sepsis. And there's usually an evidence of COVID-19. Evidence of COVID-19 can be either direct, they could have had a positive COVID-19 earlier, or could be indirect, they could be just a serology positive or a likely contact with patients with COVID-19. Treatment for these people is usually supportive. They are treated with IV immunoglobulins, steroids, and the newer drugs called as this tocilizumab and other supportive care. They generally recover with this treatment. So considering the various organ systems which are affected, you can see that post-COVID-19 needs an holistic assessment. Multiple organ systems are involved, various complaints. So we need to assess and manage the breathlessness, the post-viral cough, the oxygen requirements. We need to look at the patient psychosocial assessment and rehabilitation, assessment and management of anxiety, assessment and management of fatigue, a palliative care, and always a consideration of a new diagnosis of a venous thromboembolic disease whenever a patient presents to us, because the incidence of this is quite high in a post-COVID-19. I would like to mention here that at Narayana Health, we have started a post-COVID-19 holistic clinic, which comprises of a physician, pulmonologist, yoga therapist, dietitian, physiotherapist, a psychiatrist, all of them together to assess the needs for the post-COVID-19 patients. So when does this rehabilitation for COVID care start? Rehabilitation starts not at the time of discharge or in the follow-up, but it happens from the time you get admitted itself in the acute setting in the ICU or HDU, where we identify potential patients who are likely to develop the post-COVID-19 complications and initiate them into various rehabilitative measures to help them achieve a good quality of life. Next, we go on how to manage some of the common symptoms of post-COVID-19 after discharge. So some of these positions, many people after discharge have breathing difficulty, sometimes called which is called breathlessness. So some of these positions can help patients manage their breathlessness better. One is relaxed sitting, as you can see from the picture, a forward lean standing, and backward lean standing with legs spread apart with support on the back with the head bent forward. The forward lean sitting with a pillow and a forward lean sitting without a pillow and a high side lying. These are some of the positions which can help patients manage their breathlessness better. Next, we come to some of the exercises which can help to manage your breathing. Breathing exercises can help to manage your breathlessness and reduce its impact on everyday activities. There's something called as breathing control. How do we do it? You take a slow breath in through your nose. You try to relax your shoulders and neck. Allow the air to fill up from the bottom of your lungs to the top of your chest. Breathe gently out through pursed lips as if you are going to blow out a candle to create the space for the next breath. Follow this with the next cycle. This is called as breathing control. Next, you can practice this breathing control while walking or doing activities. This will help you to walk on a flat surface, climb stairs, and negotiate slopes. Try to keep your shoulders and upper chest relaxed and use your breathing control. Time your breathing with your steps. Breathe in, take one step, breathe out, take one or two steps. Make sure you have a good air circulation in the room by opening a window or door. Use a wet towel to cool the area around your nose and mouth. This can help reduce the sensation of breathlessness. Please note, additional oxygen will not make you feel less breathless. Many people are of the opinion that if you have oxygen, you will feel less breathless. It is usually no. You need to practice these exercises, these techniques. Second is trying to breathe a rectangle. Find a comfortable position. Look for a rectangle shape in your room wherever you are. It can be a window screen, it can be a TV screen, or anything which is of a rectangular shape. Move around the sides of the rectangle with your eyes, breathing in on the short sides of the rectangle and breathe out on the long sides. Again, breathe in on the short side, breathe out on the long side. This will help you remain focused and help you to manage your breathlessness better. Next, we come to some of strategies to manage your cough. Cough can be either a dry cough or a productive cough where you bring out sputum. Some of the strategies to manage a dry cough will be: one, it's important to stay well hydrated, sipping any soft drink. Soft drink meaning not a carbonated drink, any juice, a fresh fruit juice. Take small sips, steam inhalation. Home remedies you can try: drinking warm honey and lemon or any other warm drink. This can help soothe the throat. If you do not have a drink to hand, but you feel like still coughing, you have a dry cough, you can try to swallow repeatedly. You can swallow saliva repeatedly. Some of the strategies to help manage a productive cough or a wet cough. Again, it's important to stay well hydrated. Steam inhalation will help. Try lying on either side as flat as you can. This can help drain the phlegm. Second is you can try moving around. This can help to move the phlegm so that you can cough it out. Next, we'll come to some exercises to help clear your chest. There's something called this active cycle of breathing technique exercise, which consists of 3 breathing exercises that together help you clear the mucus of your chest. One is the breathing control, like I discussed earlier. Then you take deep breaths, 3 or 4 deep breaths. Following this, you take a medium-sized breath in and then breathe out forcefully for a short time. When you breathe out, you must keep your mouth open and use your stomach and chest muscles to breathe out rapidly. Repeat it 1 or 2 times. When you follow this technique, you will always finish on a cough or a huff sound. Stop when your huff is dry on 2 consecutive cycles. Again, some of the positions which can help keep your chest clear are: to drain the upper portion of your lungs, you can sit comfortably in an upright position. If you are breathless and you're unable to tolerate these then head down positions you can try, like side lying with a pillow and a high side lying with 3 pillows. To drain the lower lobes, you can lie on your right lobe side with 2 or 3 pillows under your hip. And to drain the middle lobes, you can lie down on the right lobe side with 1 or 2 pillows under your hips. These positions will help you to keep your chest clear. However, you should be careful and not do this if you have any nausea or reflux symptoms, if you have wheezing, if you become breathless doing this, if you have any blood in your sputum, or if you have had any recent chest, spine, or a rib injury. So, exercising after leaving hospital. So, when can we exercise after leaving hospital? You can resume your exercises as soon as you feel fit. It's important not to strain yourself because your activity levels not be the same as before. Exercises will help to improve your fitness, reduce your breathlessness, increase muscle strength, improve balance and coordination, improve your thinking, reduce stress and improve your mood, increase your confidence and improve your energy. Next is managing stress, anxiety, or depression. This is very common after post-acute COVID-19. It's important to get enough quality sleep, eat sufficiently and eat healthy, be physically active, stay socially connected, do relaxing activities, and gradually increase your involvement in your daily activities. Some people will have difficulties with their voice after being ventilated. Usually the moderate and severe cases, because they would have been intubated. So if your voice is raspy or weak, it is important to keep talking only when it is comfortable. Do not strain your voice. Take rest. Try humming to yourself to practice using your voice while being careful not to strain. Use other ways of communicating, such as writing, texting, or using gestures if talking is difficult or uncomfortable. And sip water throughout the day to help keep your voice working. Next is about managing eating, drinking, and swallowing. If you experience difficulty swallowing, these techniques may help. Sit upright whenever you eat or drink. Remain upright for at least 30 minutes after meals. Try foods of different consistencies. It can be thick and thin to see if some foods are easier to swallow than others. Concentrate when you eat or drink. Take your time when eating and take small bites of food. Chew well before you swallow. Eat smaller meals. If you cough or choke or your breathing becomes difficult when you eat, take a break to recover. Again, managing problems with your attention, memory, and thinking clearly. Exercise helps. Your brain exercise, such as engaging in new hobbies or activities, puzzles, word and number games, memory exercises, and reading may help. Prompt yourself with to-do lists. It can be with notes, alerts, phone alarms that can remind you of things you need to do. Break down activities into smaller individual steps to avoid feeling overwhelmed. So, like I told you, after a severe illness, you may not have the same energy you used to, and some tasks may take more effort than before. It is normal. You will recover them with time. If you feel like this, the following strategies might be helpful. Adjust your expectations for what you can do in a day. Set realistic goals based on how you are feeling. Save your energy by doing tasks sitting down when you can. Do not try to take up full activities until you are ready. Next, again, a common symptom, how to manage the post-viral fatigue. This was a pamphlet given out by the Royal College of Occupational Therapists. So it basically allowed time, have fun, stop your regular work, and try activities slowly, take adequate rest, set up a daily routine, engage in some thinking activities, slowly increase your activity levels. A diet post COVID 19, you must have a high calorie, high protein diet, stay adequately hydrated, and multivitamins you may continue for a few weeks. Thank you. You can mail your questions to the below mail ID where I will answer you all.
Thank you so much, Dr. J. Ranjit,
Yeah,
MD, Senior
yeah.
Consultant,
Thank you.
Internal Medicine at Narayana. Thank you so much for this wonderful presentation. And I am sure that people who are watching us live, about 1,500 people, and the people who will watch this video again on our website will definitely are going to benefit from the uh, insights and inputs that you have shared through this presentation. There is one question that we would like to ask you.
Yeah.
How severe these respiratory system related diseases are when it comes to children, when it comes to kids, and what kind of care the parents should be taking for them in times
Okay.
of COVID?
Yeah. In these COVID times, for some reasons unknown, kids seem to be doing better than adults. The
Yes.
proportion of people actually getting admitted with the COVID 19 is very less. It
Okay.
is so children tend to do better. They are treated only supportive management. As you all know, there is no specific treatment for COVID 19. Whatever
Yes.
we are giving are all assumed to be having a role. The only
Right.
proven things which have really helped in COVID are one is an anticoagulation, steroids for people who are hypoxic, okay, and remdesivir, which we feel as is strongly beneficial for patients, but a few trials which have been published recently say no. But we are yet to come out with our trial results, which have a strong role for remdesivir. None of these
Yes.
are actually given for children. Children are given supportive, and among the children treated with us, also all of them have recovered well, and very few, like compared to around few thousand patients, our numbers of children being affected are very small.
Yes.
Children tend to do well. And usually,
Right.
if a family is affected, the children are also affected. Many a times we see the parents are positive. Children, for some reason, they are not able to swab the children. In those people, we ask them to do an antibody test after two
Yeah.
weeks, and the children come out to be positive. So the antibody is positive, saying that they had already developed the infection. They didn't have symptoms or had very mild symptoms, and they have recovered on their own.
Right.
The importance of children being affected is when everything opens up, when the lockdown becomes infected, they may become an asymptomatic carrier.
Hmm.
You understand? They may go to school, go out, come back. They may not get affected by the disease per se, but they may be passing on the infection to the elders at home who are
Yes.
very vulnerable to the disease. That is where it becomes important.
Right. Thank you so much for sharing your answer, sharing your insight on this. The other thing that one of the viewer has asked on WhatsApp is he wants to know more about the breathe rectangular mechanism that you just talked about
Yeah,
in your presentation.
it is very simple. You just imagine your TV screen. Okay,
Uh-huh.
a rectangle has it's uneven. It has a shorter border and a longer border. So you
Yes.
breathe in as you focus on the rectangle, say the shorter border, the vertical line. You breathe in as you move your eyes on the rectangle. Breathe, take a deep breath, and take
Okay.
two breaths out when you go focus on the longer end. It's
Okay.
very simple. You can refer back to the presentation. I've given it out quite detailed there.
Yes.
These
Yes.
yeah,
Yeah, so I also would like to tell the viewer who has asked this question that you may please again visit the website, and you are free to watch the video again from beginning to end. You can watch this entire video again, and you can again go back to the portion where doctor has spoken about breathe a rectangular exercise, and it will definitely going to benefit you. One more thing doctor would like to ask you. Nowadays, there are some tests in the market which says that find out if you had COVID infection in the past. We get a
okay.
lot of notifications on Facebook also, on social media also, and we are seeing this kind of advertisement also. What these tests are and why there is need for anyone to understand whether there has been any
Yeah.
infection in the past in your body.
Yes. See, like I told you, not all, there are quite a proportion of people who have an asymptomatic or very mild illness who escape detection. If you
Hmm.
remember the slides also I recollected for diagnosing post COVID 19 sequelae, a prerequisite for a positive test is not needed. Okay. So again, I told you about the children also who never tested but would have. So now these tests are specifically the antibody test. Suppose we develop an infection, our body tends to develop antibodies. So if these antibodies, suppose you do these antibodies tests, you get the IgM and IgG antibody tests which are commercially available. So the presence of an IgG or a total antibody for COVID-19 shows that you would have picked up the infection in the recent past.
Hmm. Okay. Okay.
So it just
Okay.
shows that, yeah, suppose you had the COVID and your antibody is positive, you can say you have developed a good
Okay.
good antibodies. And suppose you have not had the infection or you suspect to have been exposed to COVID, you do the antibodies and it comes positive, then it says that without you knowing, you could have developed the COVID 19 and you are already immune. You have developed
Right.
antibody. How long the immunity lasts is again debatable. They say up to 6 months. So the number of reinfection cases are still very less, which are being reported. So you can assume that you are immune.
Right. One more question I'd like to ask you, doctor, because again, this is something which we have been hearing a lot, which we have been talking about it, since the first case of COVID-19 found in this world is steam inhalation, right? So a lot of people are doing that at home. We are purchasing new steam pots and we are doing it. How effective is taking steam
Okay.
every day,
So,
twice or
so
thrice?
there's some, yeah, I think the way it's being communicated is wrong. Steam inhalation does not kill the virus.
Yes.
Okay. Okay. So you must be careful when you use steam because people come up with burns and other things. Steam just tends to give you a symptomatic benefit, helps you to clear your phlegm.
Okay.
Okay, makes your phlegm, the thick mucus becomes a little more thin for you to expectorate it out. It gives you a soothing sensation in the throat. Okay, so that is where it helps. It gives you symptomatic relief. It does not helps to kill the virus. Okay.
Okay. All right.
Yeah.
We were listening a lot. Actually, these are some doubts many of our viewers would like to understand, like drinking hot water, steam, and then people are claiming that you need to.
They all do not kill the virus, give you symptomatic relief.
All right. Okay. Thank you. Thank you so much for this. One more question. Probably this is the last one that we are going to take today, but not the least, is how important is it to prevent pneumonia in diabetic patient? This is one question that has been asked on WhatsApp on our
Yeah.
Facebook page.
It is very important to prevent pneumonia. So we do have vaccines, okay, against the most common organisms. So diabetic persons are recommended the pneumococcal and the influenza vaccine.
Right.
Pneumococcal vaccine once before the age of 65, and a influenza vaccine, which is an H1N1 vaccine, which is given every year. We routinely practice vaccinating all our diabetic patients and other immunocompromised persons with these vaccines.
Right.
Unfortunately, adult vaccination is not given as much importance as childhood vaccination.
Right. Right.
Okay,
Thank you
so
so
there are.
much. Yeah, thank you so much for sharing this input. And this is what we have been. I'm just checking my Facebook page if we have any other question, but there are these were the major questions that have been asked to us on Facebook page and WhatsApp page. So once again, we'd like to inform everyone this was the second session today by Dr. J. Ranjit, who is a senior consultant internal medicine at Narayana Health. And before him, we had a session on yoga by Sohini Roy Chaudhary. And thanks to all the viewers who have been able to watch our program live. Those who have not been able to watch us live can always go to our website and click on the past video. They can go to past videos section and they can again, watch the videos from starting to end. So those who have joined us recently would like to tell them that please do not miss the session from next Sunday onward for the next 6 months with the support of Viatris. We are with the support of Viatris and with the support of Narayana Health and with the support of Uttar Pradesh Ayush Society. We are going to organize dedicated sessions by experts every Sunday for the next 6 months. So I request you all, when you join live, you have the liberty to ask questions. So I would encourage you to join live. Of course, you can watch the videos after any time on our website. But if you watch live, you may please ask whatever you want to ask to our experts. With this, we would like to close today's session here. And once again, we'd like to thank Dr. J. Ranjit. Anyone who want to get in touch with the doctor, please write to us. Please write to us at eHealth Magazine. They can get in touch with Elite Techno Media Private Limited. Our contact details are there on the Facebook, and we will be more than happy to connect you with Narayana Health and with Dr. J. Ranjit. Thank you so much. Thank you, doctor. Thank you so much for this.
Thank you, Arshil, for giving us the opportunity for their patient listening this early Sunday morning. Thank you
Thank
all
you,
for
sir.
it. Thank you.
Thank you so much. Thank you, everyone. Bye bye. See you next Sunday.